다음에 이쪽에도 넣고 Okay, let's start about the Elcure therapy. I'm Dr. Young-ki Shim, Seoul, Korea, as director of the Yonsei S clinic and the Regen Tech company, and then Dr.'s Regen lab. I will introduce about my therapy, Elcure therapy, about the electrical human cell charging. So, I am at the moment I am 72-year-old now, and then I majored in the plastic surgery specialist, and then I've been working at the National Medical Center for many years, and then after that I opening my private clinic, and I've been in Sweden, Uppsala University, and then Japan, Kitasato University for the rotation professor, and then later I visit Eduardus Krankenhaus in Germany and started to treat varicose veins since 1995, and then I founded Korean Society of Phlebology in 2001, and then I opened my clinic in China 2000, in Dalian 2006, in Beijing. Now I developed Elcure Regen therapy since 2017. It's up to now about 8-year-old now. So Elcure is, what is Elcure? Elcure is the abbreviation of the electric cure. And then I already said my patient, no set principle. What is a no set principle? No steroid, no analgesic, no drugs except antihypertensive drug or diabetes mellitus drug, such as metabolic disease. You can take drugs, but other analgesics or the another drugs, I recommend to my patient to stop use drug. I think auto healing is the best principle of the human body and no side effect of the drug. So I developed electrical charging theory. So I will tell about so many things about the cell electricity, and then the YSIC, and what is LYMPH SLUDGE, and so on. First, why I developed the Elcure Regen therapy is, I think I am treating so many lymphedema patients that is incurable disease, most oftenly developed by after cancer operation. In Korea, uterine cancer operation, there is lots of lymphedema in their leg, And then after breast cancer operation, they developed upper arm lymphedema. I tried to treat them by microvascular surgery, but it is almost failed without any success. So I think why the lymph disease is very difficult to treat, and I'm making some theory that is not the lymphatic fluid only, but it has some the part of material accumulated in soft tissue. So I designated as lymph sludge. That is the concept. So I try to find out another article in medical article about the lymph sludge, but I cannot find it. Just in Chinese medicine, they have some concept of the sludge, but it's quite different from me. So I think the main cause of lymphedema is accumulation of lymph sludge. So I think how can treat the lymph, eliminate the lymph sludge from the body? That is my study subject. So what is lymph system? Lymph system is mainly doing three functions: circulation, detox, and the immune function. And as for circulation, in the human blood, volume is 3 liters, but the lymph is 12 liters. It's maybe 4-fold much, but many doctors don't know much about the lymph function. So that is very difficult to study and then investigate for the lymphatic function. So that you see, this is the artery and vein, and most openly lymphatic system is green color. So it is magnified. This is a lymph node, and it drains into the vein system. So there is two systems of lymph system. One is superficial system, and then the inner system. Inner system most of many lymph nodes located in the abdomen, in the intestine area. But the superficial system is neck area, axilla area, and the inguinal area, like this. And it superficial lymph system drained into the subclavian vein, like this, here and here. There's a main outlet of the lymph system. So you see that this is a lymphatic system, like this, like this. So I measured in lymphedema patient, and I classified by ultrasonogram like this. It's normal, first stage, very slight, and second stage, and third stage, fourth stage, like this. This is lymphatic fluid, and the white one is congested with lymph sludge tissues, like this. The mild stage is just hyperechoic shadow by ultrasonogram, and then the disease progresses. You can see the black shadow. This is lymphatic fluid. This is lymphatic fluid, and this is the lymphatic fluid accumulation is much more. So stage 1, 2, 3, 4. So there are so many complications of lymphedema, like this, inflammation, lymphangitis, like this. That's a high fever and the pain. And then it's long time, it's become hyperpigmented region like this, you see, and this ulceration and the warty change, and then it hyperkeratotic change like this. So I think auto repair by human cell, by patient itself is the best principle, best cure. So the factor, how to regenerate the cell, what need the cell wants. That's, I think, water, mineral, nutrient, oxygen, and then electricity. But inhibition factor for the auto repair is drug. Drug makes lymph sludge much more. And the operation, the scar blocks the lymph flow, the herb, and then healthy food, preservatives makes so many lymph sludge. And the fast food also very bad for the health. So it can make lymph sludge. Lymph sludge act as electrically insulating function. So most chronic disease patients, I think there are lots of lymph sludge due to drug, operation, herb, some fast food, something like that. So I recommend my patient to auto-healing process. You need water, lots of water, minimum 2 liters per day, and minerals, vitamins, nutrients, oxygen, and then finally electricity. So I can give electricity from outside of the body. So red cells activate auto-healing program. How to stop drug? Drug is toxin, especially steroid injection, and then analgesics act as block the electrical signal, and the anti-cancer drug, radiation, and then some pain-killing drugs also block the electrical signal. So no set principle is no steroid, no analgesics, no drug, except metabolic disease medication such as diabetes, hypertension. That is my principle. So many patients is, wow, doctor, is it possible? Many doctors recommend to drug like analgesics, but you told me that you do not ingest analgesics. How to treat? So I can treat you by electricity. So my concept is human cell charging theory, and then every disease comes from lymph sludge, and my idea is electrophoresis and the electrotraction. That is my hypothesis, my theory, my concept. We can tell about the cell electricity. Everything is energy. Dr. Einstein told that. This is physics. And the human body also need energy, electrical energy and chemical energy. So composition of human body is, the number of cells is 60 to 100 trillion. Cell becomes tissue, tissue becomes organ, organ becomes organ system, and so energy, need energy, nucleus and electrons, electricity. So cell is one universe. We cannot make a cell in the laboratory. That is a creative order. Many scientists are working in the lab, but they cannot make any cells in the lab. It's come from creative order. So nucleus and mitochondria, Golgi complex, and so on. So mitochondria is very important because they make energy, electricity. So we call mitochondria are the power plant. And then cell membrane act as electrical condenser. So made in the electricity is accumulated this layer, lipid layer, phospholipid layer, and there are so many channels, ion exchange channels. So we can check in the laboratory for the cell electricity if 70 to 10 millivoltage is normal cellular voltage, and then heart is always full charged, 90 to 100 millivoltage. So there is no cancer development in heart because high density of electricity, full charged. And about 30 to 50 decrease the electricity is cellular activity decrease, and then start to feel the first pain is pain, and decrease capillary circulation and make them chronic illness and chronic fatigue. And if the electricity discharges so much to 15 to 20 millivoltage, the cancer develop or cell death. So action potential, so we can take this is action potential, pop like this, the electrical pulse like this, and skeletal muscle cell is a resting membrane potential is here, it's about 90, and then neuron 70, smooth muscle cell 80, and then photoreceptor cell minus 40, electrocyte minus 8, chondrocyte minus 8. So you can see the so many active cells has fully charged, and some kind of cell is excitable. Some kind of cells are not excitable according to the function of the cells. In the medical field, we use electricity for diagnosis, such as ECG, electrocardiogram, EMG, electromyogram, or impedance test. So I developed Elcure as objective pain detector. Pathophysiology, pathoelectrophysiology. Why sick? So many people go to clinics and hospitals and some kind of healthcare center, something like that. But everybody still have many diseases. I think cell stress, oxidative stress make disease. So that is physical and mental reasons. Physical, for example, overexercise, hard labor, repeated hard work. Is I think my patient that is the job dependent disease is most of them as a degenerative disease, such as hand or shoulder or elbow. Yes. So they are walking too much, and then it is ran out. So over exercise or under exercise. trauma, accident, operation, sports injury, metabolic disease, hypertension, obesity, diabetes, gout, hormonal imbalance, and cancer, circulatory disease, angina, myocardial infarct, degenerative disease is knee, hip, disc, stenosis, inflammatory disease, bacterial, viral, fungal, immunologic disease, allergy, autoimmune disease. Mental and spiritual disease has also give the cell stress. Another factor is habitual addiction, environmental factor, pollution, water, food, noise, genetic disorder. So I make a graph like this. Cell stress make mitochondrial dysfunction and then decrease the cell membrane potential. This is a cell discharge, the concept. And decrease the microcirculation and then accumulation of lymph sludge and then inflammation. It takes a long time, but the fibrosis, taut band can make this. So this is vicious cycle of the disease. Elcure therapy can recover from this in every step. So you can see the full charged cell and then discharged cell. It's a normal cell, it's very active. And then about 50% discharged, the pain developed, the circulation developed, the capillary circulation decreased, and the chronic illness, and then nearly discharged like this, making a cancer cell or cell death. So this is the disease progression. Oh, so charge and discharge as the disease progress, but Elcure electrical charge can recover from the disease state to normal state. So normal cell use nutrient and making mitochondria about 38 ATP, but the cancer cell is just 2 ATP. They produce so many high production of lactate and the high glucose consumption. So the cancer cell make the body acidic. Normal cell also making alkaline state. So I can say, what is lymph sludge? Lymph sludge is accumulation of toxic material, but the ECF, extracellular fluid, we call it in the lymph vessel, we call it lymph, and then outside of the lymph vessel, we call it ECF. So the function of ECF is ion function, ionic composition. So ion means electricity. So energy and the structural membrane from the ECF, the oxygen, carbon dioxide respiration function, and the nutrient in and out, and metabolic function, and the secret waste product. And lymph sludge is high osmolar proteinous fluid. The lymph sludge is condensed high osmolar proteinous fluid. It's a waste product and the toxic material. And then it comes from stagnated lymph and then become high viscosity, and then that is good environment to pathogens such as bacteria. So lymph sludge act as electrically insulation function. And they can block cellular communication. So this is come from this is. So most of the cause of disease come from lymph sludge. This is my concept. So if the fully charged cell is very easy to excrete the lymph sludge waste product inside the cell, outside to the outside cell. This is low voltage. It's not fully communicated, but good cells easily discharge the lymph sludge outside the cell, high voltage and low voltage. So voltage is very important. So lymph sludge becomes, if the time pass, it comes from like a tomato juice and then become jelly-like and then later stone-like material. It changed like this. In the clinical feature, we can find it. This state is trigger point or taut band, and then this type is we can see calcifying tendinitis, and the cataract glaucoma is in the eye, and then Parkinson or dementia is in the brain. So it becomes like this. So the symptom and signs of low voltage cells, according to the affected cells type and function, its a symptom is very variable. In the human body, there are approximately more than 250 types of cells. So low voltage make some sign according to the cell type. So typical symptom of the low voltage is acute pain, chronic pain, and chronic fatigue, headache, nausea, insomnia, depression, dizzy, skin trouble, indigestion, decreased mental power, behavioral disorder, nerve palsy, sensory change, etc. It's a variable according to the cell's type and the cell's function. If the electricity load discharged, you can see the ruler formation of the red blood cell like this. By microscope, you can see the stacked like this. But normal, high energy, high electric energy, the cells are separate enough. So if the electricity down, they can easily make thrombosis like this. What is the meaning of Elcure? Elcure is L, so electricity, air, cure. So we can use electricity as a medicine. So if we put electricity, the mitochondria produce ATP 5 times. This like this in the mitochondria in the cell. So ATP, how to make energy? ATP, if the ATP is transformed to ADP and AMP, so electricity is produced. So Elcure 1000 is electrical cell charger, like this. So charge the cells, heal the world. This is my propaganda. High voltage microcurrent penetrate deep tissues safely, like this. Then cell membrane potential elevated and the mitochondria activated and then produce ATP 5 times more than before. And then the tissue start to regenerate. The effect of microcurrent therapy. Thermal effect, chemical effect, electromagnetic effect, production of ATP increase 500%, increase enzyme activation, calcium activation in bone, nerve, muscles. And reduce edema, bactericidal effect, electrokinetic effect, pain modulation, promote tissue healing. So, what is the action of Elcure therapy? Elcure therapy, I told before, but it cell charges from cell stresses and the mitochondrial dysfunction and decrease the membrane potential. Here we can charge the cells and then enhance the microcirculation and then dissolve the lymph sludge and prevent inflammation. So Elcure therapy collects many steps of disease progression, but every step like this. So mitochondrial dysfunction stage, production of ATP increase 5-fold, cell membrane potential charging, electrical cell charging, decreased microcirculation, enhanced microcirculation, accumulation lymph sludge, then it's melting down the lymph sludge, edema, reduce edema absorption, and inflammation, fibrosis, bactericidal effect, a fibrinolysis effect. So, because of this edema, I developed Elcure therapy. But I found so many advantages like this. This one. Cell charging. Likewise, Serapon we use every day. Cell charging the human cell. This one. Normal, pain, cancer, discharge. But we charge the cancer, pain, chronic disease, and normal. This reverse action. Electrical treatment use I named iontolisis. Lymph sludge like this, and it becomes melt down like this. Like this, iontolisis of lymph sludge. So, if the charged cell is lots of electron, and then the alkaline. If the discharged electron is very small and then acidic. And then oxidation reduction. Most of doctors and scientists think the main cause of cancer development is come from the oxidative stress. This is oxidative stress. Oxidation means loses electrons. So if I can give electrons to the cell, it can be reduced, reduction. So oxidation stress means produce much lymph sludge. What is the difference between conventional electrophysiotherapy and Elcure? Conventional electric therapy is most popular used in the hospital and clinics, TENS, ICT, but the spec is quite different. So electricity is dynamic pulsed current, Elcure continuous sine wave current, polarity is bipolar or 2 or 8 polar, but this is unipolar, and current is 50 to 150 milliampere, but this is microcurrent under 1 milliampere, and the frequency 4 to 10 kilohertz, most of them, but this is 50 hertz, low hertz. The voltage is 50 to 220, but Elcure is 1500 to 3000, high voltage. And the penetration power is Elcure is very effective to deep tissues. Pain control is temporal, but is long effect. ATP production or TENS RCT is inhibit, but Elcure's increase fivefold. So it can make regenerate the cells, regeneration effect. That is the great difference from conventional electrical devices. So most of conventional devices target is muscle and nerve stimulation, but the Elcure is electrical cell charging theory and targets everywhere, every cells. Ionolysis of lymph sludge and enhancement of cell regeneration and nerve regeneration. Elcure diagnosis. My theory. Electrofriction means a slight frictional resistance can be felt by doctors or therapists when the probe make contact and glide over the skin during scoring, like this. Then I can feel the electric friction sound. That is proportional to the degree of pain and the degree of discharged amount of cells electrically. Electrotraction means in the cell side, I am very hungry cell because electrical discharge, they tract the electron. So it is also proportional to the pain degree. This is my theory. In the cell side, electrofriction is doctor's feeling. So internationally, so many pain doctors use this vasoscope, but it's the patient subjective judge by the patient, not by the doctor. How do you feel? How much do you feel pain? Like this? Oh, I'm okay. It's 0. Oh, it's a little bit. Oh, 1, 2, 3. Oh, moderate, severe. 4 to 6, and very severe. I'm feeling very painful, like that, 7 to 9. and the worst pain is 10. But the patient, the sensitivity for the pain sense is quite variable. It's not evaluated by objectively. So Elcure pain score is made by me that can objectively judge by the electrofriction sound or right. Easy to find trigger point. CT, MRI diagnosis cannot find trigger point, just morphological change or structural change. This is pain sense. Elcure pain, Elcure diagnosis is depending on the pain sense. So, BAS score is subjective pain sense by patient, and Elcure score is objective physical reaction by the degree of electrofriction and judged by doctor. So you can see and hear the electrofriction sound. The area of strong sound means discharged state, or there will be trigger point. The area of low sound means charged state. It's good state, a normal cell. So you can hear the sound of this area. X, here is the sciatic nerve there, and electrofriction sound examination revealed that is sciatica here. And the spine, lumbar spine, thoracic spine is okay, no problem. This is pain diagnosis by Elcure objective, like that. You can see again. And then if the sound, bigger sound, the patient can feel a little bit electrical stimulating feeling. The degree of sound is different from point to point. Here is the main problem, but here is a little bit. So here is fully discharged, and here is about 50% discharged, and here is normal. 네. This is my patent. Elcure diagnosis of the trigger point. That is my patent. What is the indications of Elcure therapy? Every sort of pain, fracture healing faster, abdominal cramp, headache, and eye, enhanced vision, macular degeneration, cataract, glaucoma, ENT area, enhanced hearing, tinnitus, vertigo, increased immunity, and all sorts of cancer therapy. They can use adjuvant therapy and diabetic foot. And the indication, all sorts of musculoskeletal disorder, the facial palsy, CV palsy, CRPS, and peripheral nerve regeneration, anti-aging effect, enhanced skin condition and skin disease, also post-inflammatory hyperpigmentation, all kind of degenerative disease, and lymphedema, swelling, enhance survival rate of stem cell grafts, recover liver, pancreatic function, fibrolysis effect. So many indications, because many cells need, every cell needs electricity. So we can treat every sort of disease by this machine. How to do Elcure therapy? At first, I recommend strongly to stop your drugs. No more steroid injection, no more analgesics, no drug, except metabolic disease, such as diabetes and hypertension. Let the patient supine, keep dry skin, keep dry air, keep good insulation, and check the trigger point, and apply Elcure. One trigger point is 1 minute till pain decrease. Move another point. Average one treatment time is 20 to 40 minutes per session. During treatment, there will be ionizing pain. So, mainly treatment to the trigger point is we can get the best result and the quickest result. And indeed, repeated treatment. So this is pain threshold at first one-time treatment and second-time treatment and 3 times treatment and 4 times and 5 times. Then the average level of the electricity elevated by time. So acute pain, we recommend 20 minutes every 2 or 5 days, session 1 to 5 times. As for chronic pain, 20 to 40 minutes every week, and the session more than 10 times. In the cancer and then autoimmune disease, that cancer and the autoimmune disease is very, if I charge the human cell by Elcure, but it discharges very quickly. So I recommend the cancer patient and autoimmune disease every 3 times per day, 30 minutes to 60 minutes every day. I treated so many years, and I can show you my treatment case. As for lymphedema, I developed Decobell therapy. Decobell means detox, compression, bandage, and Elcure. Is combined therapy. I present my paper at the meeting of the Chicago in 2016. So lymphedema here, and after treatment, you can see that is changed to pink color and reduce the swelling there. And this area also you can see before, and immediately you can reduce the swelling because it melts down the lymph sludge and become immediately softened. And another patient, arm lymphedema here. And you can see this one is reduced much. This one. After 3 years, much better than before. I added this severe patient, I used the lymphosuction. This one, lymphedema patient. This one, reduced much. So the patient is much better than before, and the quality of life is better than before. This is case of facial palsy. Before, you can see this polarized here, and the incomplete closure of eye like this. After treatment, as for facial palsy, early treatment is the best result. After long-term facial palsy, it's not possible to become normal because the muscle tissues is atrophied. So I recommend my patient to come within 3 months. That then can get good, best result. Now another patient case, uncontrolled diabetes. He was 66-year-old and hypertension and 3 times leg amputation here due to diabetic atherosclerosis. And then he complained phantom pain, and then 1 coronary artery bypass graft to the heart, and then peripheral neuropathy, and also this is also on the big toe. I treated like this. At first, he came to my clinic. HbA1c was 11.6 and become 7.7 or after 6 weeks. And then the insulin, the continuous insulin, long-acting, and then this fast-acting insulin is, he gave 12 units per day, but it discontinued after 4 weeks, and then long-acting insulin is reduced in half dose. So we can control diabetic complication also by Elcure. Another case, this is HbA1c is 12 like this, and by time you can see the changes of this one, diabetic foot, and become 6.6 after 4 months treatment, become normal. As well, singles, herpetic pain, so like this, you can see the scab and bulla like this, and then become normal. And the pain also much decreased. This, if the single cases, early treatment is strongly recommended. And this is case of pustular psoriasis. So I use detox plus Elcure, detox therapy, and then after treatment, it becomes nearly normal. First treatment or second treatment, there is some phenomenon, is more aggravated symptom. We can call this Yarishi-Hexheimer reaction. Within 2 weeks, this is very, very uncomfortable to the patient. But this is one course how to get better condition. This is toxin reaction, I think. Yarishi-Hexheimer reaction within 2 weeks. But after that, become much better. This is the leg case and become nearly normal. The pemphigus cases is also kind of autoimmune disease, and it become not easy to treat by the dermatologist, but I treated this patient with detoxel therapy. This one. Atopy. It's become better. The pustular psoriasis, pemphigus, atopy is all of these skin diseases is kind of autoimmune disease, and they have to control after completely heal. Every month or every 2 months, they should treat after healing. If not, it can be recur, come again, the atopy cases, better than before, like this, atopy. Rag edema and PIH also it's not easy to treat, but it takes time, but it's okay. Good result. He is 156 kilogram and reduced before and after. You can see compare. You can compare that. This one also 79-year-old and edema and the PIH, hyperpigmentation, and then 2 years after, 26 months after, you can compare that, completely healed. And sciatic nerve, sciatica is come from here, sciatic nerve. Sciatica cannot be diagnosed by CT or MRI, but Elcure can detect trigger point. Sciatica is various form of sciatica pain, like in the anal area or in the buttock area or in the trochanteric area or thigh area or cuff area or foot area. The degree is very, very variable to the patient, and I diagnose sciatica like this.
네, 좌골신경이 안 좋아.
You can hear the crispy sound on this area. So I diagnose as sciatica. And this is frozen shoulder case. Stop. 이 자리. 여기 점점 빨간 점 찍어. 여기 엄청나게 먼저 전기. You can see that this area is the most strong sound from here. So cracking sound. The degree, according to degree. So crispy sound is making that area will be trigger point. And the muscle spasm, cough. There are lots of people come to my clinic, and by sonogram, you can see the hyperechoic shadow there. Muscle cramp, leg swelling, leg heaviness. And if I check by ultrasound, it is white colored. So this one. Before, you can see the white patch here. I think this condensed lymph sludge accumulated here and become a little bit black color. And another case like this, and then it becomes black color. And the symptoms the pain relieved so much. 10 to 15 sessions. And this is arterial stricture. Ascending carotid artery, you can stricture area here, and it become thicker. It need very long time, 16 months. So, but this is not easy to place the intravascular stent. So I treated this patient for 16 months, and it's very good afterwards. And acute liver failure cases, I can check by blood test. SGOT, SGPT is before that was 400, and then 940, very, very bad. But after treatment, it become normal result. Radiodermatitis. After cancer operation, she received so many radiotherapy here, and the skin is nearly very bad condition, and stony heart. And after long-term treatment, it becomes normal consistent, becomes soft, from stony hard to very, very soft, and then the color recovered so much. And the first time, she cannot feel here the sensory discomfort. She cannot sensory changes, very dumb and numb and something like that, but after that it recovered. I developed the Decobel therapy for the lymphedema patient. It composed of detox, compression, bandage, and Elcure combination therapy. Detox plus Elcure is just for the pain, chronic disease, cancer pain, autoimmune disease. I applied this method. So we can see the summary. Elcure therapy is not just neuromodulation, it is cell charging. Elcure restores the bioelectric potential, then powers life at the cellular level. So this is conventional devices and Elcure system give its target muscle and nerve conventional, and the Elcure is a cell and lymph itself. And Elcure can read long-term regeneration. Principle: floating potential high voltage microcurrent. Electric field lines entering cell, and finally voltage recovered. Key feature of Elcure is a floating electro circuit, alternating polarity, deep tissue penetration, cell membrane restoration, cell charging. This like this, high voltage. Cellular mechanism is a cell voltage restoration and the NAK pump normalization, mitochondrial ATP production, and then oxidative stress reduce inflammation, and the hormonal factor increase the tissue regeneration. This is very important concept of lymph sludge eontolysis. So I usually call electro-detoxification step. So membrane potential recovery, lymphatic reactivation, anti-inflammatory modulation, metabolic enhancement, interstitial pressure reduction, edema. Clinical result. So I'm very proud of the electrical therapy. Has no side effect. It is not chemical treatment. It's just electrical physical treatment. So there is no drug side effect. So effective Elcure therapy is effective pain control, more faster, more powerful. Cellular regeneration, activate nerve regeneration, peripheral nerve. Enhance the blood lymph circulation, reduce the swelling. Finally, if you use Elcure therapy, anti-aging effect, and then is very, very good for the cancer patient as an adjuvant therapy. And I use the magnetic powder with the Elcure therapy, powder patch. So Elcure can read your cells heal by themselves via supplying necessary electricity from outside. So auto self-healing is the best cure, no side effect. Stop drugs, painkiller, stop. Avoid steroid. I wrote Elcure therapy in Korean as my book. And then the Korean FDA approved, and I tried to, and then registered, not approved yet, US FDA. This is my patent and my book. So future vision, so I want to share my Elcure therapy in the world, global expansion, and then I can share my clinical experience with global doctors. I hope, and then many, I hope many patients in the world who cannot treat easily and then suffering from incurable disease, my Elcure therapy can help this patient without side effect. This is my clinic. Thank you so much attention. And you can email me if you have any question or anything. You can contact me by email. Thank you so much.